Good morning. I'd like to stand here today and deliver good news, but that's not the case today, and that's not going to be the case for days to come. Our hospital systems are barely hanging on. The weekly average of admissions of new patients to our hospitals is now 3 times what they said they could handle. They're likely days, not weeks, away from coming to the point where they have more patients than they can take care of. So let's let that sink in for a minute. Our hospitals are now going to be faced with patients who will seek treatment that they will not be able to take care of because they simply don't have enough healthcare workers to provide the care that everyone needs. There will be not enough beds to provide a space for everyone who needs care. And this is the United States, with the best healthcare system in the world, and we are struggling to take care of everyone who needs it. Not just here in the St. Louis area, but across the country. We are here because there was not an early national response. Politics reared its ugly head early on in the effort to drive a wedge into an aggressive national response, a public health response to a pandemic. And a pandemic and how we should respond to it should not be something that divides us. It should be something that unites us. But that division has resulted in a massive loss of life in our country. It has devolved into arguments about personal freedom, personal responsibility, government overreach, and whether there's really a pandemic or not. We should talk about the steps to stop the virus and how to protect the health and safety of everyone, and we're not doing that enough. We have a national nursing shortage. Healthcare workers are so fatigued that many of them are worn out, they're burnt out, and they may not all be able to continue. Others in the healthcare system, our respiratory therapists, our doctors, our nurses, they can't continue like this. And I don't know how to say that any more clearly. We don't have a consensus on how to respond to the virus. St. Louis County acted early because we had the first cases in our country, and we're acting now because the cases of the virus continue to rise in our community, and they're rising too fast. If we don't take aggressive action, we'll reach a point where we can't stop this spread without much, much more personal sacrifice. We know that our actions are damaging the economy, and we know that businesses are hurting. And I feel badly for the great men and women who are trying to push through in this tragic time in our history. I implore our leaders in Washington to get together and provide a stimulus package that can help our businesses and help our residents who are suffering. We need the financial assistance, and we need it now. This should have happened months ago. County government does not have enough resources to make everyone whole and to provide for all the needs of our businesses and our residents. This is an American problem, and it's something our country needs to come together to solve for everyone in our country, in addition to the people in the St. Louis region. Restrictions do provide hardships, but they are short-term hardships that provide us a pathway to a long-term solution. This is the only way to drive down the infection rates and provide the hospital capacity we need to make sure our healthcare workers can take care of our patients and they don't have to make the painful decisions about who can get care, who has to wait, and who has to die. For our businesses to threaten to launch legal fight against our public health orders, that's certainly their right to do that. We have been through this before over the past 8 months, and we know how all of these legal actions will work out. For those who are defying the public health orders, I hope that you will think about the safety of your employees and your patrons and the people that come to your businesses. And I don't know why anyone would want to eat at a restaurant that doesn't follow health orders. By going against public health experts, you are telling our public health workers that you don't appreciate or respect the sacrifices that they are making to keep you safe and your family safe. Non-compliance with our health orders is no longer an individual decision. We are months away from a widely available vaccine, and we have to rely on the few tools we have to stop the spread of the virus. Our public health leaders, our nurses and our doctors and our healthcare systems are telling us that something needs to be done now. There must be a comprehensive action to stem the tide. Next week, the holiday season begins for many of us. This is a time that we usually sit down with our friends and family to enjoy a meal. We understand that. I ask that you limit your gatherings to those who are in your bubble. That means 10 people or less of your family and your friends. Within this bubble, you can't belong to more than one. Even when a group gathers, all participants should practice social distancing, masking, and everything necessary to prevent the transmission of the virus. And if any member in a bubble gets sick, then that person must immediately tell the others so they can quarantine and they can get tested. These are the requirements of our Safer at Home order that went into effect yesterday. This is the worst the virus has ever been in our community. Every day we are breaking new records on hospitalizations, on ICU admissions, and we know that that trend will not change for 2 weeks. And whether it changes or not depends on whether everyone in our community will follow and comply with our public health orders. Yesterday I heard an ominous and frightening report from our pandemic task force. We are nowhere near the worst of the impact of this virus in our community. We need expanded medical facilities, and we need more doctors and nurses. But there are no more doctors and nurses available anywhere in the country. Everywhere in the country needs more doctors and more nurses. So everyone must dig deeply in our community and decide, how much can I change my behavior? How much sacrifice can I make? We shouldn't be asking ourselves, what can I get away with? We can't sit here and hope and expect that someone else will do it, that our lives can remain unchanged and someone else can make the sacrifice necessary so we can continue doing whatever we like to do, and we can get through this with the mindset that it's someone else's fault. That's not how this is going to work. Please don't gamble the life of yourself or your loved ones. This is serious, this is real, and many more people are going to die. So I ask you again, do everything you can to protect yourself and your loved ones. Follow the public health orders and help us in this fight against this pandemic. I'd be glad to answer any questions.
Dr. Bailey, could you explain specifically as you can why restaurants aren't safe places? We've heard a lot of debate about this since the new restriction has went into effect. Specifically, is it the airflow? Is it the building? Is it people congregating there? Specifically as you can, why aren't restaurants safe at this point?
Well, many places in our country, our public health officials, our medical experts have explained how this virus moves about. It's an aerosol, and it moves about in a room. It moves farther without a mask. It remains in a room depending on how long you're there. And we know from our public health experts, and it's intuitive, that sitting close together without a mask in a population, when 1 in 25 or 1 in 50 people are walking around with the virus without symptoms, that this virus will continue to spread. I respect and understand people who will make the arguments that it's not all coming from restaurants and bars, or restaurants and bars are not the worst, but we know that they are part of it. And because this virus is spreading so quickly in our community, our public health experts have made a decision that we need to limit the ability of the virus to be transmitted in restaurants and bars. And other places in the country who have gotten worse have gone farther with their public health orders and have gone back to even more restrictions like we saw back in March in our community with non-essential businesses only. And that's where we're headed. We are headed past bars and restaurants, and we are headed toward a greater shutdown unless we can stop the transmission of this virus in our community and we can get our hands around it.
So the safety issue of bars and restaurants is more with people being inside them, not so much with the structures themselves or that?
There are small adjustments that can be made to make it better, and we will work with folks to do that. But again, bars and restaurants are a part of the way this virus is spreading. Our public health officials, based on the science of how the virus spreads, the information that they have decided that it is important that that is part of our closures at this point in time. And if we don't get our hands around this, if we don't stop the spread of this virus in our community, then we will need more extensive orders than closure of bars and restaurants. That's what we're seeing across the country, and that's what we can expect here if we don't change what we're doing.
You've said in the past that you have, or you said now as well, that you have evidence of spread in restaurants. You know specifically about the amount of cases or something that you can really kind of hang your hat on?
No, I would refer you back to the Public Health Department, and I recognize how our bars and restaurants are disadvantaged, and I recognize their enthusiasm to stand up for their industry. And all industries do that with an enormous amount of passion, as they should. But our public health experts are telling us that now is the time that we should limit the activity of indoor dining in bars and restaurants, and I trust the judgment of our public health experts. This is not unique to the St. Louis area. This is happening across our country, and this is a sad reality of what happens when we hesitate to make the easy decisions early, like the rest of the world, or we don't have a national response. Then we're left with making these more restrictive decisions at later points in the pandemic. Any other questions?
Conversation about being able to properly cite these businesses that continue on being open?
Yeah, I know, our legal team will work through that. Our public health officials will work through that. What we're seeing is a massive response in the restaurant community of compliance, a massive communication of you're doing the right thing. We will always have outliers in every business sector, and they will sort themselves out, and we will deal with it on a case-by-case basis.
You alluded to it a little bit earlier, Dr. Page, that more restrictions aren't out of the question. Is this the beginning of what could become more stringent if this doesn't work?
Well, absolutely. We're seeing that across the country. And if we don't get this virus in check, if we're left with our hospitals being overrun, and that's the direction we're heading. There are, back in the beginning of this pandemic, we could get a few extra doctors and nurses, but there is no bench, there is no supply of doctors and nurses in our country that we can go to because everyone in the country is facing the same challenge. So we're left with these non-pharmacological interventions, these non-medical interventions that are hundreds of years old, and that's keeping people apart, quarantines, isolations, limiting gatherings to try and prevent this virus from moving about in our community. That's the tool we have until a vaccine is widely available. We're all excited about the medical discoveries. We're excited about the vaccine pipeline, and it is coming along on schedule, but it will not be here in time to stop the massive loss of life that our community is about to face.
Looking at hospital numbers, are we still sitting at about 15% of those people being from rural outlying areas outside of the county? What are we seeing?
I would have to refer you to the Pandemic Task Force to talk about where those folks are coming from. I know that early on, the rural communities and the areas outside of St. Louis County were driving the hospital admissions. At this point in time, many of those admissions are coming from St. Louis County.
Doctor, is there any talk about opening up additional buildings as temporary hospitals, like the situation in North County with the hotel earlier this summer?
Yeah, we're actually in conversations with the state about whether or not we can open up extra facilities. But extra facilities is part of the question. The next question is, where do we get the doctors and nurses to take care of the patients in those extra facilities? Because our doctors and nurses are working overtime, extra hour, double shifts they're exposing themselves to the virus. Some of them are losing their lives. And there are only so many doctors and nurses, and there is only so much overtime that they can work. And by not complying with our public health orders, we're sending a very clear message to our healthcare workers that we are not grateful for their sacrifices. We are not grateful for them putting their lives on the line to protect us, and that we would rather continue doing what we want and not be inconvenienced. And I recognize that there are many people who are making great sacrifices. Many people have lost their jobs. Many people's businesses are in jeopardy. And it is a responsibility of our federal government to step up and find the financial relief to keep everyone going, to help our businesses and to help our citizens who are suffering, who are at risk of being evicted from their homes, losing their homes, to not having something to eat. That we need a national response.
What role does, I know you said your contact tracers are just completely overwhelmed and focusing on the populations that are at high risk, but what role does not having them in a comprehensive way play in inability to stop the spread? I feel like that's an integral part in
Sure.
trying to identify.
We can't test or contact trace ourselves out of a pandemic if our citizens are not doing their part to prevent the spread of the virus. All of our public health guidance and information, literature, science tells us that when we have a positivity rate over 5%, contact tracing is much less effective and becomes ineffective. And we're now over 20% in our positivity rate in our community, 40 and 50% in some parts of our state and our country. We just can't contact trace our way out of this. We can't hospital our way out of this, and we can't doctor and nurse our way out of this. There just aren't enough resources to make up for bad decisions that people are making. And everybody needs to stand back, step back, and ask themselves, what is my role in stopping the spread of this virus in this community? What is my role?
Dr. Page, I have one question, and from the Post-Dispatch. It's related to what Caroline asked. What is the county going to do about people dining at restaurants, including Bartolino's? And will the county sue or arrest individuals or businesses?
You know, we'll follow all of our legal options. We'll get to that. We certainly will. At this point, we're focused on the communication piece of this. This is how we've done with all of our public health orders. We focus on the communication. We explain why it's important. We explain the gravity of the situation. We respond to the massive positive feedback we get, and almost without exception, whenever we have guidance for our community, just about everyone in involved business sector are in compliance. There will always be outliers. There have always been outliers, and I'll leave it up to our county attorneys and our public health department to follow up with them and make sure that they're in compliance too.
So you do have an enforcement arm that you can use to go after these businesses if they're not in compliance?
Yeah, we've been dealing with this for 8 months in every business sector, and there's some individuals and there's some businesses that are wired for confrontation. There are some folks that just don't yet understand the gravity of the situation. There are some folks that are very passionate about how this worldwide pandemic and this national pandemic is affecting them. And it's absolutely clear that some people are deeply impacted and devastatingly. Massive loss of life. People have lost their loved ones. We're struggling to keep kids in school. We have businesses that are affected. This affects all of us, and we're not dismissive of that. But we have to follow our public health guidance to stop the spread of this virus in the community. We can't test and contact our way out of this. It is moving too fast. There are not enough hospitals or doctors and nurses to treat our way out of this. It's time for people to make some real and serious sacrifices, And it's up to our federal government to come up with a financial package to try and help people recover. It's going to be a very difficult time in the next few months in our country and in the St. Louis region.
You good?
Any questions? Okay, thank you.
Thank you.